Dear colleagues, welcome. In this lecture, we focus on brow lift with botulinum toxin, achieving a subtle, natural lateral brow elevation while preserving expression. The flow is course style, applied anatomy, treatment goal, patient selection, mapping and technique, fixed dosing, complications, and practical pearls. The Orbicularis Oculi is a circular muscle, much like the Orbicularis oris. It encircles the eye and lies over the orbital bone, forming a complete ring. When it contracts and shortens, it enables tight eyelid closure and eye squeezing. It is a thin muscle. This is why we use microinjections in this region. In this session, we focus on the upper lateral segment of the Orbicularis Oculi, which exerts a downward pull on the lateral brow. Reducing activity here allows the frontalis to express its elevating action laterally. Aging and gravity shift facial tissues downward. Most patients appreciate a gentle lift of the lateral brow. Also remember the interaction with forehead treatment. If the frontalis has been suppressed in a way that presses on the brow, your lifting effect here will be diminished. Always consider the balance between brow elevators and depressors. With advancing age, as brows descend and the upper eyelid becomes heavier, many patients habitually recruit the frontalis to keep the eyes open. You will often notice a persistent, raised forehead expression as a compensatory mechanism. Aim for a soft, natural lateral elevation, a non-surgical effect reminiscent of a brow lift surgery in a gentle version, similar to the refreshing look of a tight, high ponytail, not an exaggerated arch. In women, this lateral lift is often distinctly rejuvenating. In men, a flatter and more natural elevation is usually preferred. Too much lift can undermine a masculine aesthetic. Therefore, set targets by individual anatomy and patient expectations. Best suited for patients seeking a fresher, more open look without dramatic change. Assess baseline brow position, skin elasticity, habitual frontalis recruitment, and asymmetries during animation before planning. Map with the patient animating to read vectors and asymmetry. Inject with the muscle relaxed. Target the upper lateral orbicularis oculi fibers slightly superior to the lateral brow tail, avoiding injections too close to the brow margin. Use superficial microinjections consistent with the thin muscle architecture. There are 3 described techniques for toxin-based brow elevation. Only the first, lateral focused approach should be used outside of expert hands. Do not attempt the second or third variations unless you are highly experienced, as a single misplacement can lead to a prolonged and demanding complication course. Dosing. Per point, use standard, non-adjusted microdoses per injection point. Botox: 1 unit per point. Dysport: 3 units per point. Apply to 1 or 2 points per side based on anatomy and symmetry mapping. Critical placement notes. Too inferior, too close to the brow increases the risk of brow ptosis. Overly superior placement may miss the functional fibers you intend to modulate, reducing effectiveness. Maintain precise, mirrored placement for symmetry. Brow ptosis, most commonly from injections placed too inferiorly in the lateral depressor zone or from excess depth. Depth-related risk. A deep pass can allow diffusion toward deeper structures. In extreme cases, unintended effect may reach the levator palpebrae superioris, leading to eyelid dysfunction. Respect the superficial microinjection principle. Asymmetry. Due to unbalanced point selection or mapping, prevent with careful pre-marking and mirrored dosing. Post-procedure. Advise patients not to rub or massage the area in the immediate hours after treatment. Practical pearls. Map with animation, inject at rest. Keep your lateral points consistent and symmetric. Small shifts are visually meaningful. Coordinate with any forehead plan. Excessive frontal suppression that loads the brow can negate the lift. Photograph and video document baseline and outcomes for objective follow-up. Today we covered the logic and execution of lateral brow elevation with botulinum toxin, the ring anatomy of the Orbicularis Oculi over the orbiter bone, the rationale for microinjections in the upper lateral segment, aesthetic goals, candidacy, precise mapping, fixed per point dosing, Botox 1 unit per point, Dysport 3U, key placement pitfalls, and prevention of complications. In the next modules, we will move to the lateral and inferior orbicularis applications, crow's feet and under eyelid indications. If this lecture provided practical value, please like the video. It helps the algorithm and strengthens our professional community. Post your questions and cases in the comments. I'm happy to discuss. See you in the next lecture.